I want to welcome all of you to Family and Children's Agency's 7th virtual conversation. Today we have a wonderful, distinguished panel who I'm going to introduce in just a couple of minutes. And today's focus is on early childhood education and how important it is in the life of a child and, of course, a family. For those of you who are not familiar with Family and Children's Agency, we are one of the largest nonprofits here in Fairfield County. We work with children and families and adults and seniors. We have a range of services, including licensed behavioral health and mental health services. We have services that provide specific focus on child abuse and neglect. We have an after-school program. We work with seniors and we work with the elderly. And those are just some of the areas that we focus on. An important area for us is the topic we're going to be talking about today, which is early childhood education, and what we call here at Family and Children's our child and family development areas of service. And you're going to hear about that as we go forward. Today's topic is obviously a very important one. As I think everyone knows, the importance of early childhood education and preparation for a child to go into school is hugely important. And all of the studies indicate that without the kind of support that you're going to hear from our panelists today, children can really fall behind and frankly never catch back up. So in a minute, I'm going to introduce our distinguished panel. But first, a couple of housekeeping pieces. At the end of our conversation, we are going to take questions from all of you. If you look, you can enter in the Q&A section found at the bottom of the screen any questions, and we'll do the best we can to answer your questions from obviously this distinguished panel. So let's get into it. Let me introduce the panel. First is Stephanie Coswell, who is the director of Growing Seeds Child Development Center here in Norwalk. Stephanie has over 25 years of experience working in this space and is going to bring an awful lot of experience and knowledge to this panel. Next, we have Mary Kate Locke, who is a vice president of youth and family empowerment here at Family and Children's Agency. And her areas of oversight include foster care, our family support area where we're dealing with child abuse and neglect issues, our adoption program, and yes, today's topic, child and family development issues and education. And then finally, we have the pleasure of having Mary Oster, who is the early childhood coordinator for the city of Norwalk and has extensive experience in the big picture of this area. She sits on a variety of boards here in the Norwalk community and also on some statewide boards, including the Connecticut Early Childhood Alliance and Steering Committee. So welcome to all of the three of you. So I'm going to start with asking each of you, and I'm going to start, Stephanie, with you, to just describe a little bit about your role as a director of a child care program and how that relates to the topic that we're talking about.
Hi, good morning, everyone. I'm Stephanie Croswell. I'm from Growing Seeds. I've been in this field for about 25 years. We have two locations, one at Trinity Place in Miracle Temple and one at Ben Franklin. We serve about 100 families. We have been enrolling children, and we help families enroll children from 15 months through 5 years old. It's very important for children to be enrolled in preschool and toddlers. We start the foundation, like I said in the beginning, at 15 months. We help families with an array of things, whether it's potty training, helping parents take their children off of pacifiers, starting our preschool with the potty training and reading and development. So there are an array of things that we do help families with, and we also help them with outside sources too. So that's just a little bit of what we do at Growing Seeds.
Terrific. Thank you, Stephanie. And Mary Kate.
Hello, everybody. About 12 years ago, my role at Family and Children's Agency expanded to include oversight of our early childhood home visiting programs. And with that, I became a member of the Norwalk Early Childhood Council and began to sit with my colleagues in the early childhood space, representing a community agency and the in-home work that FCA was doing. But more importantly, my goodness, did I begin to learn what was so special about Norwalk and all of the early childhood partners that come to the table all the time to look at how best to support children in their early years and families, and really working with parents to help them see that they're their child's first and best teacher. So I've learned so much from my colleagues here in Norwalk, and happy to be here today as we talk about creating the best early start for kids.
Terrific. Thank you, Mary Kate. And Mary.
Hi, Rob. Thank you so much for having me today. I have been in this role as the early childhood coordinator for the city for about 13 years. It's kind of a unique role around the state. There's not a lot of us. And I do, every day is different. And I really have the pleasure of working with all of our childcare programs in the city, whether it be family childcare or center-based care, funded programs, non-funded programs. I work a lot with Head Start. Having a childcare program can be a little bit isolating, especially for our family childcare folks. And I always feel like I want to be like the great connector, and make sure that they have all the resources that they need and the support they need. As far as what resources are available, we have an early childhood office of early childhood, the OEC at the state level. And just to make sure that all that information and those resources are filtering down to our folks here in Norwalk. And, conversely, just making sure that I can be a voice for Norwalk and Norwalk programs on the state level as well, with the OEC and with the Early Childhood Alliance.
Terrific. Thank you all. So let's get into our questions for the conversation. And a question, I'm going to pose it to you first, Mary Kate, is I know this community has a particular focus on working with pregnant parents. Tell me a little bit, and our people tuning in, why is it important to get started with pregnant parents?
When we talk about early childhood, we're very often talking about birth to age 5. But what we have really focused on as a community, and it's certainly been a focus, in our state as well, is that if we engage as early as possible in the life of a family, and when mom is pregnant, that we have the best opportunity to provide that strong early start for children. So in Norwalk, we have wonderful partnerships with Norwalk Hospital, Norwalk Community Health Center, the Norwalk Health Department, where Family and Children's Agency has a staff member on site at those organizations who are serving pregnant women. And it's an opportunity to meet with moms-to-be and talk about their journey, their family, what will be coming up for them, when they give birth, and to really introduce them to this wonderful system of early care and education and support for families that we have in Norwalk before the baby is even born. There's so much research out there that talks about prenatal engagement and why that matters in terms of creating better outcomes for kids and families. And we're just thrilled that, we have the partnerships that we have to be able to meet so many women when they're pregnant and begin to introduce them to Norwalk's early childhood system of support.
Great. Mary, have anything to add there in terms of getting started with pregnant parents?
Yeah, parents, it's a whole new thing for first-time parents, right? And it can be really confusing and kind of daunting. So we really do want to connect with those families early, because those early years are so important. We know that You know, a baby's brain grows by the time they're a year old, they're 80% of what it would be as an adult. And so those years you can't go back. So we know we have one shot at helping parents connect to services and what they can do, how they could be their child's first and best teacher. That is so important, that parents realize what their role is. And a lot of times they don't. You know, you do what you know. And if their parents didn't read to them or didn't, you know, talk to them and really interact, get down on the floor and play with them, they don't know that that's really important. So we like to make sure that all parents have the resources they need so their kids can thrive.
Great. Stephanie, but what about you? Working with pregnant parents, which obviously is before they get to your program, but what are your thoughts on that?
I think it's very important to give them resources. I think, like I said, we start off at 15 months. So some of them do come with knowledge, but they are still seeking some more resources when they get to us because they're toddlers. But I definitely think it's important, having 3 children of my own, getting the resources before you deliver while you're pregnant. So I think that is key.
Yeah, terrific. So we often hear, and certainly new parents often hear, about developmental milestones. So I wonder if you can all share, and maybe we start again with you, Mary Kate. What are we talking about when we talk about developmental milestones between birth and, say, age 5?
So, you know, what we're really talking about is 5 core areas of early childhood development. And we've worked really hard in Norwalk to be able to kind of speak the same language about these key areas of a child's growth and development. So we're looking at their fine motor skills, gross motor skills, problem solving skills, personal, social, and communication skills. And when we talk about milestones, we're really talking about, where do we expect children to be as they grow up from birth to age 5 in each of these areas. And so our work in Norwalk has really been, again, as early as possible, to be talking to parents about milestones and what to expect as their children are growing up in these early years. You know, I remember when my boys were young, I didn't know, I was around young children, but when I became a mother and I was so focused on how my kids were growing and developing, it was other parents around me and my pediatrician that were able to really help me understand, okay, this is what to expect at certain stages in the life of your kids. And so I think that is, just a critical focus of our work, is helping parents just to know what to expect in each of these areas as their kids are growing up.
So Stephanie, in your role directing a early childhood program, I'm going to guess that you probably have some parents who get pretty anxious about this. And
Absolutely.
So could you comment a little bit on that?
Yes. So one of the things that we do, like when we have an orientation or open house, we give parents the child development milestones in the beginning. And that sort of calms them down a little bit. We'll go over those milestones with them, because sometimes parents just don't know where their children should be. So like if they're, 3-year-olds, we often, just guide them to understanding the milestones of where they should be, some of the things that they should be doing. So for some of the 3-year-olds, we'll say, they should be climbing, they should be playing make-believe, doing different things like that. We'll also give some of the parents some tools to bring home with them so they can use some of those tools at home with the children. So it's just very important. We also try to teach them to also do it through play, which is very fun for the children. So there's definitely a lot of different milestones, for the children, but we do try to give parents the tools so they can help their children along with the development milestones.
Ask a follow-up question, Stephanie, which is, this is a diverse community, and many families, English is not a first language. And I'm curious how the program really supports those parents in helping their children develop language skills as they come into your system and then go on to school?
Well, we have bilingual teachers, but also we had a reading program for our bilingual parents. They would come in the evening and we would have someone that speaks Spanish come in and teach the parents how to read to the children at night. And they were able to get free books. They were able to learn tools that to be able to get the children to relax and to be able to read the Spanish speaking books. So it's very important. We do everything dual language here. We also do a little Creole because we have families here that speak Creole too. So we try to get our books, any handouts we get, we try to do it in every language so the parents can understand. And if somehow we don't have a translator, we will find a translator to help them understand what we're trying to relay to them.
Great. Mary, in your role, this issue of, families from diverse backgrounds and maybe English is not a first language. What are you seeing in terms of the community? Stephanie runs a wonderful early childhood education program. I'm going to guess maybe not all of them have the same kind of supports that maybe Stephanie provides, but what do you see?
Well, we do have a very diverse population here in Norwalk. And we try and encourage family. And that's when I talked about what families can do and how important it is for families to be involved in this. We, anymore, we don't really even say, read to your children, share books with your children. We also have families who are not literate. And so we want to make sure that they have so much to offer. You can sing to your child, you can tell stories, you can look at the pictures and talk about the pictures. And so we really want to involve families as much as possible. Go to the library, encourage them to go to the library. We have a lot of little libraries around town, little book boxes and laundromats, barbershops, places where families are waiting. And those books fly out of those places, but there's something for family. We want to make sure that families know that there are those resources there for them. Most of our childcare programs that especially serve our Spanish-speaking population, we're so fortunate to have a lot of community resources, but also a lot of bilingual staff. And that is so helpful for parents. Oftentimes they're new to this country, and so things are so confusing. So within our programs, we're just so fortunate to have folks who can help them along, get them connected to the services that they need. And we're just delighted. So many of our community partners have staff that are Spanish speaking. So it really is, really helps families so much and it's changed so much in the last even 10 years. So we're really happy to be able to provide those services.
And a follow-up question to you, Mary, is, parents who are at this point where they're looking for quality early childhood programs. What should, in your opinion, parents be looking for? What are some of the key things that are important for parents to kind of say, look, I need a program that maybe has this kind of approach or resources?
Sure. I think it's always really important to visit a program and to get a sense of what the day looks like, what the schedule looks like. Obviously, you want a program that's clean, that the children look like they're happy. Not all kids are happy all the time, so you might see a child crying, but what's the interaction like between the teacher and the child? You want to make sure that they're open the hours that you need. And most of our programs here in Norwalk are year-round, full-day programs, so that allows parents to work. And sometimes, I think you have to just go in and really observe, talk to the director. You can always go online and check licensing to make sure that have they had citations against them? And I'm proud to say that our programs here in Norwalk do very well. With licensing, we have many accredited programs, so they are really following the national standards, best practices through the National Association for the Education of Young Children, NAEYC. So that's a really important thing as well. That doesn't mean that programs that aren't accredited are not good. And then we have our family child care that are wonderful nurturing places for kids. And so that's another, that's another resource. They have most of our infant and toddler care, and that's nationwide. And so those are great places to, but always, I think always look and just, feel, and then ask friends and neighbors and family, because they usually have really good recommendations as well.
Great, great. Well, thank you, Mary. So I'm going to switch a little bit to something I've heard in the community, and I'm going to ask you, Mary Kate. We often hear about the Ages and Stages questionnaire. Can you share a little bit about what that is and its importance in terms of the topic we're talking about?
Sure. So the Ages and Stages questionnaire is a developmental screening tool, and it was a tool that was created for parents, but is certainly used by parents and providers alike to be able to screen for early childhood development and look at those milestones that we were talking about. So in Norwalk, about 10 years ago, we were lucky enough to receive funding from a foundation that would look at how we create a system for developmental screening using the ASQ for children birth to age 5. So, the ASQ was being used by many providers in Norwalk. But what we were really looking at was how we created a systematic way to screen kids and really look at the data. What was the data telling us? What were the results of the screenings telling us about how children were doing over time? So we began to really, look at the work that is so strong here in Norwalk of collective impact. So how could we bring together a cross-sector partnership, began using a common tool, which is the Ages and Stages questionnaire, as a metric around early childhood development, and really look at, rather than individual providers using the ASQ, collecting that data in a centralized place so that we could understand how children were doing at the individual level, at the program level, within certain neighborhoods in Norwalk, and certainly at the community level. And the goal was really that if we were screening children routinely as they grew up in our community, and we were sharing that data and looking at that data with parents, that we could intervene early in the life of a child if there were any developmental delays, really talk with parents about activities that they could be doing with their child, all with the ultimate goal that we were able to move the needle in Norwalk and ensure that children were entering kindergarten ready to learn. Any child who enrolls in kindergarten in Norwalk, parents are completing an ASQ, which is a really important time for us to be able to see, how are we doing in early childhood? How are children in Norwalk doing when they're entering kindergarten? And what kind of information can we then share with Norwalk Public Schools using that ASQ about how children are doing that are entering our kindergarten classrooms? So, the ASQ, I look at Stephanie, I look at Mary, over 27 community partners using the ASQ, really using the results of the ASQ to support individual children, parents that are really engaged in their children's development, because we have been so intentional about helping parents understand what this screening tool is about, what activities they can be doing to support those developmental milestones, and how the providers in Norwalk are working together to support them as individual parents, but to support all families in the community as well.
And I just wanted to say also, we do use Ages and Stages at Growing Seeds too. Once the student is here, after 45 days, we will use Ages to Stages, and it actually really helps the teacher support the child and the family. They come up with great ideals, and the system itself, Ages to Stages, comes up with tools to help families and the teachers. And we have found that very good for parents and the teachers to use the tools that it presents to them. So we really enjoy using it, and we've gotten great feedback from Ages to Stages from the parents also.
That's great. And Mary, does essentially all the programs in Norwalk use Ages and Stages questionnaire?
So all of our funded programs do use the Ages and Stages.
That's great.
And so that is about over 700 children. That includes a significant number of toddlers. The screening tool is such a good thing. You know, when parents see something and they don't always know, they do the Ages and Stages. There it is. And it's a wonderful way for them to kind of compare with the teacher, but it's also a way for them to see that, hey, maybe we need to do something here. And then that way they can do, get maybe birth to 3, whatever, or maybe there's just a little piece if they, maybe give their child more opportunity to do some fine motor skills, and they have wonderful activities that the parents can support them with. And then the next time they do a screening, that has gone up to the next level. And so that's really important because it shows how you can support kids, in all those developmental areas. The other thing I just want to mention, Mary Kate has mentioned our community partners. We have early childhood community advocates through Norwalk Acts, and they are going out into the community at different events, different, the library, different places, and really talking to families with real little kids who maybe aren't in a program, and encouraging them to do the Ages and Stages through the Spark. There's an app called the Sparkler app, and they can do the Ages and Stages questionnaire on that. And then those parents get that feedback, and then they can find out how they can support their child in different ways. But it's a wonderful tool, and there's so many activities. Sometimes parents don't really know what to do, like after you've played with Play-Doh, I mean, now what else do we do? And so these are just great resources for families to be able to, do something else that maybe they didn't think of with something that they have at home. They don't have to go out and buy a new toy to do that.
That's
Rob,
great.
can I just add, it's interesting as we look at this work with the ASQ, all of us come from a different early childhood sector. So Family and Children's Agency, we are a part of the network of early childhood home visiting programs here in Norwalk. So we are going into homes, meeting with families, looking at child development, and our home visitors are completing, the ASQs with parents. But what we really have learned in this work is, there's a lot of screening tools and assessments that we use in early childhood. And, as we've been at this work over these last 10 years, what we heard from parents is, my pediatrician or my preschool program or my home visitor does a screening or an assessment, but I don't really understand what the tool is and what it says about my child. So I think that's been, I can speak for us in home visiting, letting parents take the lead in completing the ASQs. We're completing them from the time a child is 2 months old until they go to kindergarten. So a lot of screenings over time. But for parents to be able to really take the lead in completing that ASQ so that they know, okay, these are the areas my child is doing well developmentally. This is where they might need some more support, and what can I do as a parent? But for a pediatrician, it may be different. How are they using the ASQ? We see some, our pediatric providers that are doing screenings, but again, they're not sitting with a parent in their home like we are in home visiting, but in a well child visit or in a follow-up, what's the conversation like with parents about the result of the ASQ? And then, Stephanie speaks about the implementation in our early care and education programs. I think the biggest piece for us is engagement of families, is using the data to really help have a common language with parents and providers about, this is my child, this is how they're doing developmentally, and all of these people in Norwalk really care about my child. in the early years, and that when they head off to Norwalk Public Schools in kindergarten, they've had all the support and resources they need, and that I've had support as a parent too.
Yeah. And it sounds pretty clear from what I have heard that one of the great benefits of the Ages and Stages questionnaire is the involvement of parents, and that the parents are an active player in this process. And that seems like a huge benefit. Let me switch a little bit to the issue of transitions and the transitions from home to an early childhood setting. And I know that can come with a lot of anxiety, certainly on the part of parents, if not the child. And I'm going to ask you, Stephanie, if you would just comment on what can parents do to smooth out that transition?
I would say a lot of talking, a lot of talking to the children. I think sometimes even at 15 months, I think it's important maybe to take a drive by the school that you're going to bring your child to and just explain to them, okay, Monday, we're coming to the school. This is your new school. Remember, we came 2 weeks ago to the open house. You played with toys. So mommy's going to walk you in and daddy's going to walk you in. We're going to sit with you for a little while, and then we're going to leave you with the toy, and then we're going to come back. I think it's so important that parents continuously talk to children to let them know that it's going to be okay. Mom and dad is going to come back to pick you up. Usually for the first 2 weeks, there are a lot of crying going on. So we typically ask parents to leave a photo of the family so we can always take the child back to go look at it in their cubby or on the wall. Or we ask them to bring a special blanket or something special to them so they will have an attachment from home to school. So that is some of the things that we do, along with reading books to them about transitioning, just a lot of hugs that day, closeness. And sometimes we do have the parents just stay a little longer and maybe do a circle time with us. And the children typically, maybe they don't stay the full day, the first couple of days, so they can get used to the routine for their transition.
Yeah. Terrific. Mary, any other thoughts on that whole issue of transitions for both child and parents, by the way?
Yeah, it's hard. It's hard for parents too, and I mean, I think just be really positive about it and talk to the teacher. I think that when the kids see the parents and the teacher really having very positive, friendly interactions, I think that is so important. And that's why I'm glad we have so many, bilingual teachers. It's just so helpful for parents, and parents need to be comfortable. And if they can show that comfort and positivity, that spills over to the children and they're happier. But Stephanie is right. There is a lot of crying on those first few days of school.
From parent and child.
Oh yeah, for sure.
Great. And Mary Kate, in our work at FCA, what are your thoughts on this whole issue of transitions?
It's interesting because, Family and Children's Agency gets involved pretty early in the life of a family. As I said, often, when mom is pregnant or after the baby is born, and we talk a lot about, obviously what we're doing at home to promote early childhood development. But to Stephanie's point, the value of early care and education in terms of kindergarten readiness. And we do see a lot of parents that we work with in home visiting that are, resistant to that transition to preschool. I love having my child at home. I'm not sure about sending them to school. So, we really talk about, our partners and providers in the community that we know so well at Family and Children's Agency, and just how well kids have done over time, and that these are, folks to be trusted in the life of your child. And so everything that Stephanie and Mary mentioned about transition, we try to tackle before kids are going into infant toddler programs or preschool. But, one of the things that, we're looking at in terms of outcomes in home visiting programs, we measure what percentage of children in early childhood home visiting are enrolled in a preschool program by age 3, because that is truly our goal. If we are the provider that's engaged early in the life of a family, that when we're hitting that age 3, that we're really supporting families and in helping their child to make that transition, to a preschool setting. And again, it's the choice of families, but just leaning on some of the research and what it tells us about how children do over time. When we look, going back to the ASQ, when we look at the ASQ data, we're able to disaggregate that data. And what we can see is that our children that had no preschool experience that entered kindergarten versus those that were in preschool, those children are not always doing as well developmentally. So we really use that to talk early with parents about the value of that transition into preschool, at least by age 3.
Great. Mary Kate, you mentioned home visiting. And we at FCA are certainly not unique in providing home visiting services. There are many organizations that do. What are some of the real benefits, though, of having a particular area of service where we are really able to work with the families in their own home?
So in-home support, whether it's early childhood home visiting or a lot of the in-home programs that exist at FCA and in the community, it's a window into the world of a family that you just don't see necessarily when families are coming to you on site. So we love the opportunity to go into the homes of our families. Obviously, we spoke about the focus on child development in home visiting, but we're also really focused on parents. That postpartum period is tough for moms. We see high levels of stress for any parent that has young children. And certainly, we do focus on reducing social isolation as well. How do we help parents to connect with one another? So when we are going into homes and home visiting, we are focused on child development, bringing in activities to do with kids and their parents, modeling for parents some of the things they can do to really promote achieving those developmental milestones. But we're also really focused on mom and dad. What supports do they need? Are there resources that they need to be connected to in the community? Are there concerns about food insecurity, housing instability, mental health? Because if we can really look at stabilizing those things within a family, then we know that that's going to help to improve outcomes for the children in those families. I think when we also look beyond our in-home work, one of the components that exists in home visiting is our group work. So how do we help families to come out of their home and gather with other families? So at FCA, we do a lot of different groups for parents. So we, provide education to parents. We have a gardening group at our community garden at Fodor Farm. We have a sewing group. We have our in-home clinician that's about to start a series of groups for moms to be able to look at breathing and meditation and stress reduction techniques. Because again, if we can support the needs of our moms and dads, it matters for children as well. In-home support is one piece of what we can do. The home visiting services is one component of just a really robust early childhood system here in Norwalk. We might start working with a family at birth, but there are calls we might get from a preschool. Stephanie could call and say, hey, Mary Kate, there's a family that just enrolled in our preschool, and I think they could use some support in the home. So we could then really work to provide those wraparound services so that the child might be in a preschool program, but we can also be doing that in-home support in the evenings for families, just to make sure that families have everything that they need to be successful in those early years.
Great. Thank you. So Mary, let me start with you on a question that parents may have about maybe an issue or a concern about their child. Maybe they even think there may be some, developmental delays or special needs. What should parents do when they are looking and they say, gee, I think something isn't quite right? What might you suggest as a first step?
Well, first, they should act on that. If you think something's not right, then it's better to act on that. Talk to your pediatrician, do an ASQ. That is such a good tool at helping kind of figure that out. And do, talk to your pediatrician, but then also Birth to Three is a wonderful resource. And, it just it is just so good to know, and to know early what you can do to support your child. And if it is nothing, then you've still investigated, and you're a little bit more knowledgeable. But I think it's so important to not just say, oh, it'll get better, because we know that early intervention is key to some of this. And so often parents they're just afraid of what they might find out. And so, you just have to really kind of get beyond that and see what you could do. I mean, parents are the advocate for their kids, right? So, I mean, they've got to be the ones that step up there and do that. And so they really, as hard as it is, really to find out and then get the services, get the help that child needs. And it might be something so tiny that if they intervene now and take care of it now, when the child is 18 months old, then that's something that will be resolved, and they won't have to worry about that again. But I guess that's the big thing. Just don't be in denial about, and it's so hard. And I know Stephanie sees families, Mary Kate with home visiting, they see families that because it is really, really scary. And so I would just encourage families to, and even sometimes, the pediatrician is like, nah, no, but then like you in your heart, no, I think something's wrong. I mean, I would say just, you're the advocate. You need to speak for your child because they don't have a voice yet. So
Stephanie, what do you think?
Agree. I totally agree with that, Mary. What we try to do here is educate the parent. Don't be afraid. If you're feeling, if your children have had ear infections and you're calling them and you feel like they can't hear you, call the pediatrician. Come in, let me know as the director. I will point you in the right direction. If we have to call info line to get more information for a parent, like Mary said, Birth to Three, we also use NECC. Mary Kate spoke a little bit about home visits. We've helped parents get in contact with people to have a home visit. Don't be afraid. I think as a mother, and me being a mother myself, go with your gut feeling. And here at Growing Caesar, I think any preschool, they're there to support you. And our job is to help families and to help the child. We want to make sure they're getting assistance as young as they can, because like Mary said, if we can do it now before they get to kindergarten, this would be the best place to help them, which will be in preschool. So we try to ease the family, and I will even go to appointments with some of my families if they're afraid. I am there to support them 100%, so we can make sure the child gets all the needs for the services that they may have, need.
That's great. Thank you. Mary Kate, anything you want to add?
Yeah, I think what we're always trying to tease out is, is there a developmental delay where, early intervention or preschool special education might be necessary? Or are we just talking about, in some cases, a lack of exposure to certain areas, in terms of development? I'll give an example. My son had struggled with fine motor skills, and I remember doing the ASQ, and it was questions about, can they string a bead? Can they cut with scissors? And I'm like, scissors? We don't even have scissors in our house. Why would I have scissors? That's dangerous. And I remember my early childhood folks were like, Mary Kate, what are you doing? They need scissors, to be able to build up those fine motor skills. So we took some activities and started doing more with my son to expose him to those activities that could help really, bring out those fine motor skills, strengthen his fine motor skills. And I didn't realize as a mom, there was a delay here because I really wasn't exposing him to as much as I could. And I think that's the piece. Is it something where we need intervention, or can we help parents really understand some of the activities they can do to get their child back on track in that, developmental area?
That's great. That's great. So let me ask you all a question. I'm going to start with you, Mary. Norwalk is often cited, if you will, as a unique community as it relates to its focus on early childhood ed, and is often put up as a model. So why is that? What makes Norwalk, as it relates to this area of early childhood coordination, so special?
Well, it's the people here on this call and all the ones who are not. I almost get like a little bit, we have all been working together for so long, and it may not be the same people, it's the same agencies. We've been coming together as a collaborative. Mary Kate mentioned the Norwalk Early Childhood Council. She's been part of it. She's part of that 12 years ago that the council was formed. It's now called the Early Childhood Collaborative. Years ago, and we've all come together through the years, and that, that's what I find so unique about Norwalk. Everybody comes together. Nobody's worried about, they check their ego and all that stuff at the door, and we walk into that room and we are here to help families and kids in Norwalk. I mean, that is our goal. That is the most important thing. And we all work well together. We have worked collaboratively. We have gotten some wonderful grants. Mary Kate has mentioned the ages and stages that we've been doing for over 10 years. And the state looks at that as a model. I talk to people around the state and they're like, well, how do you do that? I said, I don't know. We just all come together. And it is just, and I kind of thought every community had this, but I guess they don't. But we are just really fortunate to have the people here that we do, and that we are really all here for the kids. And yes, the state has cited us a number of times for doing what we're doing, and we see it as what, this is what we're supposed to be doing. So I don't know, maybe Mary Kate has something more we always talk about this and how we are so fortunate to be here and to have all these great collaborations. But
yeah. Mary Kate?
I'll jump in. So, Norwalk is just a special place to do this work in early childhood. There is trust, partnership, and collaboration that exists amongst us as providers. I think because we are members of Norwalk Acts and grounded in the framework of collective impact, we don't sit and talk about what should be done for children. We use data to drive those conversations and understand where we need to allocate resources, where we need to perhaps seek more funding. I know there's a number of funders that have joined us today. It's unbelievable to see the investment of foundations in early childhood here in Norwalk. That doesn't exist in every community. We couldn't do this work without you. When you have that blend of public and private dollars, you're able to do more great work. And so I think when we can see over time that outcomes are improving for children in Norwalk, that certainly reinforces that we're moving in the right direction, but we're not afraid to look at the data that tells us where we need to do better on behalf of children in this community. So I think we are unique in terms of who the people are that come to the table. We are all here on behalf of children and families, and we're all just really proud to be a part of this work in this community.
And Stephanie, what are your thoughts about our community and how unique it is?
It is very unique. I have to say, I can pick up the phone and call any one of these ladies with any questions. And I don't think you can do that in a lot of other towns. Also, other directors, I could pick up the phone and give a call. They fight so hard for children and families. I am honored to be a part of the special group that we have here in Norwalk. My families are, the children are. I just want to say thank you. I love being a part of this community. The collaborations have been great. And it's great to have FCA above us also in just walking distance. So if I ever need anything, I know I can count on them. And Mary is a superstar. I often call her very often with any questions. So I'm honored to just be able to have them supporting us.
Yeah, that's
Well,
great.
can I just add, Mary's role, as she said, there is not an early childhood coordinator in every town and city, in Connecticut. The investment in Mary's role matters for the city of Norwalk. Who Mary is matters to all of us, because when we are running programs and providing services, having leadership at the city level, like Mary, who is all things to all people, to us as providers, to children and families. You walk through the door and Mary is there to support you. And I think because we have that investment in early childhood at the city level from Norwalk Public Schools as well, we really stand out as a community that knows if we do this right in early childhood and create these strong foundations for children, we will see better outcomes for Norwalk kids.
Yeah, and I have certainly seen that as well. I'm not aware, and maybe there are some other communities that are invested in the way Norwalk is, and to have a city position, and Mary, you have sat in that position for quite a long time and have done just a fabulous job in your role. So kudos to you and to the city of Norwalk for making this kind of commitment.
Well, everybody makes it easy for it's so easy to work collaboratively and work together, and we have just fabulous childcare programs. We're so fortunate to have that.
Yeah, absolutely. So let me ask a couple of general questions, and we just have a few more minutes before we have to wrap up today. Any of you have any thoughts about whether there's more the state of Connecticut can do to support early childhood education, not just in Norwalk, but statewide? Any thoughts on that what the state could do beyond what it does already? I know it's already been cited, by the way, the Office of Early Childhood. I know that's a particular vehicle, but any other thoughts?
Well, the governor did convene a blue ribbon panel, and that they are coming to the end of their work. They are gathering, they've done a wonderful job of gathering input from all over the state. And they're going to be making some recommendations as far as streamlining more supports for children and families. Childcare is very expensive. Our childcare programs, we're in it's a unique model because we're providing a service that it's difficult for families to afford, and programs can't pay their staff enough. Our staff in our childcare programs are some of the most poorly paid people in the United States, and yet they're being entrusted with our babies and toddlers and preschoolers. And I think that what that may be recommended is some sort of influx of money where there has been an influx of money, and it will, we all know that it's going to cost money. They've had success in helping to stabilize the industry. We know that preschool, high quality childcare, preschool is a good return on investment. We know it gets parents to be able to go to work. We have a lot of women right now who are not in the workforce because they can't find childcare. So that, I hope the Blue Ribbon panel has some good recommendations on how we can accomplish that, because we really do need some supports. It's very difficult to find staff, and Stephanie will attest to that. And we know that without really good, steady staff that's well paid, we have this kind of a constant movement of staff, and that's not good for kids. We want good, stable staff who know what they're, who know, have a lot of experience in helping children, children that may come with some things going on that we need to really, have a strong staff member to handle some of those behaviors that kids are having. And so it's really important that we pay our staff well. So we'll see what that Blue Ribbon panel recommends. I don't know, but we do know that we need some state assistance.
So Stephanie, Mary mentioned the challenge of entrusting to early childhood professionals the care and this critical time for children, and yet among the lowest paid areas in terms of workers. What's it like for you? You run an early childhood program.
Well, we were just on a Zoom the other day. It is difficult, not only for me, I would say for everyone, every director here in Norwalk and probably outside of Norwalk. We're struggling right now.
Yeah.
Being one of the lowest paid educators, it's difficult. And for children, we need consistency. And I think at this time, because of the pay, the staff are changing, or we're not getting enough staff. There's some schools that had to close rooms or reduce their ratio because we just don't, we don't have the educators to teach the children right now. So, we're crying out loud, we're screaming, the teachers need more pay. The teachers that we have are very dedicated. They come in Monday through Friday, ready to teach your child while you go to work. So we're just asking the state to just take that into consideration. They need more. And if they're not here, where would parents take their children?
Exactly. And Mary Kate, anything you want to add about this issue of what the state could do? It sounds like it's pretty clear what the state could do, but what are your thoughts?
Or, I would just echo what Mary and Stephanie have both said, affordable childcare for families so they can work. It doesn't then happen, in terms of slots available in a community if we don't have the staff to keep classrooms open. I know if I call Stephanie at any given time, Stephanie might be in a classroom teaching, and she's running a center. Her role is director, and I know how dedicated she is. So she's in there with those kids when needed. This is a story that's reflected in many of our early childhood settings here in Norwalk, because if we can't pay staff well and be able to hire quality staff in order to not just sustain the slots we have, but perhaps expand and open other classrooms, it just creates a domino effect for children and families in our early childhood workforce.
Yeah. So I'm glad we hit on this topic, because this is a hugely important one for our state, our community, our nation, frankly, and certainly for the parents who really want to find quality care, and the cost being a huge challenge for both programs and parents. So I'm so glad that we hit on this topic. We are going to wrap up, and I just have a couple of closing remarks. And first and foremost, to Stephanie Coswell and Mary Oster and Mary Kate Locke, cannot thank you enough to have such an expert group hitting on so many different topics here, and I can't thank you enough. A couple of things for people who have tuned in. There will be a list of resources that we will get out to you. If we have your emails, we'll send those out to you so you can have that. And this is a conversation that is obviously so important to happen in other venues, and hopefully in having this today, there's some important takeaways that people who've tuned in will be able to take from. Again, many thanks to the three of you. Many thanks to all of you who've tuned in. And Mary Kate also mentioned the wonderful funders many of which have tuned in today. Without you, what this wonderful group of professionals do, it would just not happen. So many thanks. And then finally, stay tuned. I mentioned at the beginning, this is our 7th virtual conversation. FCA will continue to do these on topics that we think are very relevant. And my hope is we continue to have the kind of panel that we had today. So thank you all so very much.